Hello, my name is Hannah. I'm going to be your student nurse working with you today. Looks like taking a look at the MAR. I did see an order for the doctor. He's ordered you a transfusion of red blood cells. Can you verify your name and date of birth for me, please?
Betty Johnson, 8957.
Okay, so I've washed my hands. I'm going to provide for privacy. Betty, have you ever had a blood transfusion before?
No.
No? Okay. Do you have any allergies that you know of?
No.
No? Okay. So something that we are going to be looking for, a possibility with a blood transfusion, is there's always that possibility for a reaction. What that would be is, possible hives, any kind of fever, itching, nausea or vomiting. If you do have any of those symptoms, please make sure that you let me know. Okay?
Okay.
All right. Any other questions you might have about that transfusion?
No.
No? Okay. I do see here that you have signed that consent for blood products. So what I'm going to do is have my colleague run down and grab you that blood. And while she does that, I'm going to prep for the blood product, okay?
Mm-hmm.
All right. So I'm going to wash my hands. So what we're going to be doing today is we're going to run some normal saline. Regular saline is the only thing that we can run with blood products. So I'm checking the expiration date on that saline, and it looks like it is August of 2021, so the saline is good. I also want to check the saline for my saline flush here. I see that that expiration date is also August of 2021, so those are both good. So we're going to take a look here at your IV site. I do see that you have a 20 gauge in, so that's perfect. For blood products, you want an 18 gauge or bigger. So we're going to go ahead and clean that site. Let that dry. All right. And we're going to go ahead and flush that site with 5 milliliters of normal saline. Okay. Good. Okay. Next thing we're going to do is we're going to go ahead and hang this bag of saline. So we're going to take out our IV tubing. I'm going to make sure that all of my clamps are closed so we don't have fluid running all over the place. Okay. So I would invert that saline solution. I can poke the bag. Okay, once that's hung, we're going to go ahead and prime our line. To do that, we would have to open We're going to make sure that all the air bubbles are out. And we're also going to fill our drip chamber. Once the air bubbles are out, we're going to stop that. We're going to fill our drip chamber. We want to make sure that it's above the filter so that our red blood cells have a nice pool to drop into. Recap that for now. We can go ahead and hang this until we are ready. All right, and now we'll just wait for Carly to come back with that blood product. Meanwhile, I'm going to take my gloves off, wash my hands. All right, and it looks like Carly's here. So before we even check the blood, for compatibility, I'm going to just double check the blood itself. I'm going to make sure that there's no clots that I can see, no gas bubbles, and that the color looks appropriate. All right, so Carly, verifying the blood, I have Med record number 224466.
Med record number 224466.
Account number 123456.
Account number 123456.
Patient name is Betty Jones.
Patient name Betty Jones.
Red armband number 456654.
Red armband number 456654.
All right. Patient blood type is B positive.
Patient blood type B positive.
All right. And donor pool number is 7890.
Donor pool number 7890.
Units in the pool is 4.
Units in pool 4.
Volume to be infused is 250 milliliters.
Volume 250 milliliters.
Blood component is packed red blood cells.
Blood component packed red blood cells.
The expiration date is 6/25 of 2021 at 2000.
Expiration date and time 6/25 of 21 at 2000.
Okay. Donor blood type is O positive.
Donor blood type O positive.
Compatibility test is completed.
Compatibility test is completed.
And the date is 6/25/2021.
Date of 6/25/2021.
Okay, and prior to hanging this blood product, I am going to check a set of your vitals. So I'm going to go ahead and listen to your lung sounds. Okay, I'm also going to listen to your heart and check your pulse. Okay, so we always want to obtain a baseline set of vitals prior to giving any blood. Something else is that once the blood is in the room, we only have 30 minutes to hang it. So we only have 30 minutes before we'd have to infuse it. And then also the blood tubing is only good for 4 hours. So that's something that we need to remember also. So I'm going to go ahead and wash my hands and don some clean gloves. Okay. Invert the blood. We would hang that. We want to make sure that you can see that from the doorway. Okay. And you make sure that the normal saline is clamped. Okay. Open all of our clamps. And we're going to prime our line. And we would do that until we see the pink run through the line. Okay, once that is done, I'm going to go ahead and clean the IV site once again. I'm going to let that dry. I'm going to connect that. Wait for the pump to turn on. Okay, select new patient. Select channel B. We're going to do red blood cells. Okay. So for the first 15 minutes, you're going to run the blood at 50 milliliters for that first 15 minutes. the volume to be infused, there's 250 milliliters in this bag, so I'm going to run it at 220 just to make sure that the lines do not go dry. Make sure that that is unclamped. Just to double check my roller here. There we go. Restart that. Check for my drips. Just see. Okay. There we go. All right, and so once that blood is all done, we would run normal saline through infused to the patient once it's completed. If for any reason the patient would have a transfusion reaction, we would want to stop that transfusion immediately. We would have a coworker, RN, we would ask them to go get us some normal saline. We would get that running as soon as possible, and then after that we would call the provider and see what they would like us to do next. Some lifespan considerations. We would want to lifespan considerations, we would want to consider, like, if this patient is someone who gets infusions often, we would for sure, like, they'd be at a higher risk of developing a potential reaction. So for vitals, they're going to stay in this room for 15 minutes. We check the vitals at 15-minute mark, 30-minute mark, and then at an hour. So you check your vitals depending on, after that, it is depending on the facility's protocol. But you always stay in the room for the first 15 minutes to monitor the patient for any kind of reaction. Once that's done and the infusion is complete and you've ran that normal saline, you would go ahead and, with gloves on, you would dispose of the blood products in a biohazard bag. Clean up any of your supplies. You would go ahead and make sure the patient is comfortable, that they tolerated that okay, and then you'd go outside and you're going to document. There's a few things you're going to document. You want to document the time that you infused the blood at, that you started it at, the time that you finished. You're going to document the patient's vital signs, their IV site, how they tolerated it, the blood sequence number, the amount of units, the blood type, and I think that's it. So I would just wash my hands and